Hey guys, Kati Kleber with Fresh RN, and I want to talk to you about ways that you can become a better nurse. Let's say you're working at the bedside and you're kind of hitting your stride and you're wanting to know how you can dig in deeper. Maybe you don't want to go back to school, you don't want to do anything crazy, but you just want to get better at what you're doing. First of all, respect. I very much appreciate when people genuinely just want to get better at their job. So here's some practical things that you can do. I want you to think about the things in your shift that scare you. So maybe things that make you nervous to hear and report. Maybe it's that the patient has a chest tube, or that they had a hip replacement, or a GI bleed. I want you to think about those diagnoses and situations that scare you and write them down. And then I want you to consider how you can lean in more into learning about those. So that could be learning more about them at home, or actually in addition to when you are at the bedside, asking people who are experts in those areas for information, for education. So if you're an ICU and vents really scare you, talking to respiratory therapists. Hey, can you tell me more about why you did this? Wait, if the patient did this, what would you do and why? And asking them questions and just genuinely kind of opening that door for education. Because I've found that once you get off of orientation, people are not as open to teaching. And I don't think it's because they don't want to, it's they don't want to step on toes or assume you don't know something, because people can get insulted by that. So if you can really open the door to create a permission essentially for people to really teach you stuff, I've learned some of the best lessons that way by saying to someone who I know is good at something, to say, hey, can you tell me more about this? Or why would you do this? And you'll learn so much. And when people know you want to learn from them, they're going to make even more of an effort to teach you. So definitely encourage you to do that, specifically with those things that really scare you. Another way you can get better as a nurse is taking time to review those medications that your patients are getting regularly on your unit and considering why they're getting it. So things that have more advanced kind of pharmacokinetics, not necessarily the stool softener or the laxative, but maybe really digging back into what the beta blocker does or the ACE inhibitor, how they're different. Or maybe today you gave a patient mannitol for the first time for your patient with increased ICP and you don't really know why, but it was ordered and it was a big deal, so you gave it. I think the way that you can really solidify those experiences is when you go home, looking up the medication, learning more about it, and the pharmacokinetics around it, like how does that work to actually decrease ICP? You can actually look up great YouTube videos that show those things in graphics, or reading up on it. And I find that if you can time that with a patient experience, it really helps your memory. So, okay, I gave mannitol to this patient who had increased ICP after this specific thing happened, and then looked it up. So then the next time your patient needs that specific medication, you have this memory and this experience to draw from. And then you could also do something where you create a note in your phone with those high-level important things to remember about administering that medication at your specific hospital. Another way that you can become a better nurse is asking what you can stop doing. So I've found that a lot of people tend to just kind of carry things on from the next shift to the next shift, and before you know it, we have tons and tons of orders for a patient that make no sense. Nurses who want to get better are looking at orders and saying, why do I have that on my patient's chart? Is that something that can be discontinued or completed, resolved, something that's no longer applicable? Asking the physician, hey, can I get rid of the order for this, this, and this because I noticed the patient's no longer getting that treatment? Or considering all the orders that your patient has. Do they really need telemetry? Do they really need the continuous pulse ox? Do they really need Q4-hour BMPs? And finally, one great way to learn is to ask your providers, so not just the physicians, but also the nurse practitioners, the PAs, what is your differential diagnosis and how did you get here? So that means, okay, the patient came in with a certain set of symptoms and maybe in their brain they thought it was 4 different things, and there could have been these 4 things, but because of this they know it can't be that, and because of this they know it can't be that. So it's got to be one of these 2 things, and here are the tests we're going to do to differentiate between this and this. Like hearing their critical thinking as they work through why they're doing what they're doing is so valuable. So if you have a provider you've got a decent rapport with, and you're just, hey, just curious, what is your differential diagnosis here? I saw on the note you said this. I'm curious, just because I'm trying to learn here, how you got there. And as long as you frame that in a curious tone, not a explain yourself tone, that really opens the door for them to teach. And I've found that over the years, providers really enjoy teaching and really enjoy specifically teaching nurses that they work with regularly. Great way to build rapport and a great way to become a better nurse. All right, I hope you thought that was helpful. If you have other ways that someone can become a better nurse, I hope you can include that in the comments so other people can learn from you too. Please make sure you like and subscribe. And I've also got an email list where I send out great little tidbits every single week, nurse stories, advice, and things that I learned the hard way every week in your inbox. So the link for that is in the description of this video. Thanks, nurses. Stay fresh.